I'm going to be taking the manual blood pressure test, and the following that I need to perform the skill is gloves or hand sanitizer, something to record result on, a sphygmometer, a stethoscope. The first step is to observe standard precautions, use proper hand washing technique before taking the manual blood pressure. The second step is to verify that the cuff is the correct size for the patient and that the valve is closed to allow for inflation of bladder. The third step is to place the patient in a relaxed sitting position, removing the clothing from the arm and position the arm at heart level. Instruct the patient not to talk during the procedure. The fourth step is to locate the pulse of the branchial artery in the inner aspect of the antecubital space and place the arrows on the cuff over this area. The fifth step is to place your fingers on the radial artery and inflate the cuff until you can no longer feel the pulse. Note the reading and add 30 to it. The sixth step is to deflate the cuff by opening the valve, turning the valve counterclockwise, wait at least 30 seconds. The seventh step is to place the stethoscope in your ears in the correct position. The eighth step is to place the diagram of the stethoscope over the branchial artery and press gently. The ninth step is to close the valve, turning it clockwise and inflate the cuff to the predetermined amount. The 10th step is to slowly release the valve, turning it counterclockwise so the cuff deflates evenly about 2 mm Hg at a time, and listen for the first sound of the pulse returning to the branchial artery, making a mental note of the reading, syntolic reading. The 11th step is to continue allowing the cuff to deflate until you no longer hear any sounds from the branchial artery, making a mental note of the reading. The 12th step is to open the valve completely and let the cuff deflate rapidly. The 13th step is to remove the stethoscope from your ears and the cuff from the patient's arm. The 14th step is to record the finding promptly and accurately. And the last step is to obtain correct systolic and diastolic pressure reading within 4 millimeters of mercury. As for the multiple choice, 21, which number is the diastolic? If the blood pressure is 134/76, the pulse is 70 and the respiration is 14. B. 76. 22. Which of the following would be a reason not to use an arm for a blood pressure reading? I put A. Patient had mastomony on that side. 23. You took a patient manual blood pressure and the reading was 150/92. What would be the best action to take? C. Retake the blood pressure using the other arm. 24. What creates the sound of a lub tub heard when a stethoscope is placed over the heart? B. Valve closing. 25. What is the normal blood pressure range for an adult? A. 90/60 to 140/90. 26. What is the correct medical term for a blood pressure reading of 150/92? B. Hypertension. 27. What is white coat syndrome? B. Increased blood pressure during doctor's office visits. 28. Which pulse points are used when taking a palpatory systolic blood pressure? C. Branchial and radial. For the matching 29, I put H for blood pressure. 30, I put K for diastolic blood pressure. 31, I put J, hypertension. 32, I put G, hypotension. 33, I put I, orthostatic hypotension. 34, I put L, pulse pressure. 35, I put A, pulse points. 36, I put F, sign. 37, I put E, stethoscope. 38, I put D, thermometer. 39, I put B, systolic blood pressure, and 40, I put C, vital signs. I'm going to be taking the second test, which is the counting radial pulse and respiration test. The first thing you need is something to record your findings, hand sanitizer, gloves, a watch with a second hand, and a patient. The first step is to use proper hand washing techniques before taking the radial pulse and respirations. The second step is to instruct the patient not to move or talk during the procedure. The third step is to locate the radial pulse. The fourth step is to count the pulsations you feel in a 60-second period and note any variance from normal to rhythm or pulse volume. The fifth step is when you complete the procedure, leave your fingers on the pulse. The sixth step is to observe respiratory movement without making it obvious to the patient. The seventh step is to count the respirations in a 60-second period, noting any variance from normal in rhythm or respiratory effort. The eighth step is to determine pulse rate within 4 beats per minute. The ninth step is to determine respirations within 2 breaths per minute. And the last step is to record findings properly and accurately. Choice 16. What creates the pulsing sensation felt by a healthcare professional at certain points in the body? B. The heart valve opening. 17. What is the name of the type of pulse being taken when a stethoscope is used to listen to the heartbeat? B. Apical. 18. What is the normal range for the pulse of an adult? B. 60 to 90 beats per minute. 19. If the apical pulse is 90 and the radial pulse is 50, what is the pulse deficit? A. 40. 20. What is the normal respiratory range for an adult? C. 16 through 20 breaths per minute. 21. What is a medical term of a heart rate that is below normal rate? B. Bradycardia. 22. What is the medical term of respiratory rate that is above the normal range? A. Tachypnea. 23. What is the process of taking in oxygen, O2, and expelling carbon dioxide from the lungs and respiratory tract? C. Respiration. 24. Which assignment skills is being utilized when taking a patient's pulse rate? B. Palpation. 25. Specific sites on the body where arterial pulsations can be felt is referred to as A. Pulse points. The last test I'm taking is the oral temperature test. The first thing you need is gloves and or hand sanitizer, a thermometer, something to record your findings, and a disposable sheet. The first step is to observe standard precautions, apply gloves as needed. The second step is to determine the electronic thermometer is on the correct setting for taking adult oral temperature. The third step is to clean the probe with alcohol. When dry, apply the disposal sheet on the electronic probe of the thermometer. The fourth step is to ask if he or she had eaten, drank, chewed gum, or smoked within the last 30 minutes. The fifth step is to ask patient to open mouth. The sixth step is to correctly place thermometer in patient's mouth under the tongue. The seventh step is to instruct patients to close lip around thermometer and not bite the probe. The eighth step is to wait for the thermometer to signal that it has completed taking the temperature and read digital display. The ninth step is to properly dispose of sheet covering. And the 10th step is to record findings properly and accurately. 17. Which of the following mean a temperature is elevated above the normal range? A. Febrile. 18. How long after eating should a patient wait before taking his/her temperature? B. At least 30 minutes after eating. 19. Which two routes of taking temperature have the same range? C. Rectal and oral. 20. Which other two routes of taking temperature has the same range? B. Axillary and temporal. 21. What is the adult normal range temperature taken axillary? B. 96.6 Fahrenheit through 98.6 Fahrenheit, 36 C through 37 C. 22. What is hypothermia? C. Occurs when your body temperature falls below 95 Fahrenheit. 23. Which route is considered to be the most accurate? A. Temperature taken via rectal route. 24. What degree does a person's temperature has to reach to be considered as a fever? B. Elevated body temperature, usually above 104 degrees Fahrenheit rectally. 25. What is the meaning of temperature? D. The balance between heat loss and heat produced by the body.